Today, the eyes and ears of the 21st century are focused on new developments, new technologies, new emerging companies. We're on the scene to bring it to you as it happens.
We anchor from our new studios in Los Angeles and then go out all over America to get to the heart of the story.
I'm Bert Tenzer.
I'm Bella Shaw.
I'm Doug Llewellyn.
I'm William Shatner, and this is Heartbeat of America. Our show focuses on corporate America, its stories, its drama, its breakthroughs. We'll be going out today to report on an organization that is impacting our lives and shaping our future. An organization that truly is the heartbeat of America.
The 21st century is upon us.
It is the century that will be taking us further and further into space in search of other life.
But there's a whole lot more happening in this century right here on Earth. Exciting new concepts and technologies are revolutionizing the world of business, science, and medicine, and forever changing our way of life.
We'll be taking a look at that during our interview with today's guest.
So stay with us as we begin this edition of Heartbeat of America.
Now, over to our media desk where today's story is about to unfold.
Of all the professions there are, certainly dentistry is one that has experienced more technological advancements in recent time than any I can think of. And to learn more about that subject right now, we are here with Dr. James Khazian of San Diego, who is a cosmetic dentist and an implantologist, which is an amazing field in itself, this whole subject of implantology and implants. Doctor, explain to me what we mean when we say implants.
The implant is a titanium cylinder that is inserted into the jawbone, and it replaces the root of the missing tooth. If you lose a tooth, you need to replace it somehow, and we place that implant that actually replaces the root of that missing tooth, and then later on, when it integrates into the bone, we put a tooth on it.
Well, you know, this is who's a candidate that would be good for them? Give me an example.
Absolutely anybody who has missing tooth. Age really doesn't matter. We can place implants on people as young as 17, 18, up to any age that you can think of. I've had patients 95 years old, we place implants on them. A lot of people think that if they're a little bit old, they can't have implants, but that's not true. Implant is used primarily on older people because they have more missing tooth. So absolutely anybody can be a good candidate for implant if they have missing teeth.
So take me through the process that you go through for implant. I know it's a rather timely procedure, isn't it?
It takes probably about 4 to 5 months to finish an implant treatment, as we call it. If a tooth is missing, first time patient comes in, we do the evaluation and diagnosis and all those procedures, and we place the implant by a very simple surgical procedure into the jawbone and underneath the gum. And this implant, which is pure titanium and is very, very compatible with the body, it stays there for a period of 3-4 months, during which the bone grows around it and stays very firmly in bone. At that time, we expose the implant and we put a tooth on it. The most important thing about implant is that it's a freestanding functional unit that is not dependent on other teeth to hold it. It's just held by the jawbone exactly the same way the natural teeth are held in the jawbone, as the nature has provided.
In the beginning, you put some substance in the gum, though, that helps fill in the bone, the hole in the bone. Is that right? And it kind of has to adhere to the bone?
No, it's just basically it's a titanium cylinder. A lot of times it has some screws in it. It's threaded, as we call it, and we thread it into the bone, and it just stays by itself. The first time we put it, it holds because it's threaded into the bone and stays in there. But we need some time for the bone to actually grow around it and into the small particles that he has, and make it really firm. At that time, it's ready to be loaded, as we call it, which we put a tooth on it and becomes functional, and you can start chewing on it.
Now, there are other ways of skinning the cat, so to speak, without doing the implants, but the implants are better than these other procedures. Explain to me why.
Well, if you have a missing tooth, your options are get an implant or get a bridge, and in some instances you can get a denture. Let's look at the dentures. Most of us probably have seen a denture. We know how it looks like.
We've seen them advertised on TV, that's for sure.
Absolutely. They advertise the adhesives that hold the dentures. To hold the dentures. Yes. They are very bulky, as you know. It's a removable appliance that patients take it out of their mouths and put it back in there, and you can imagine what it does to the patient's self-image every time they take that denture out of their mouths and put it back in there. Sometimes they eat with it, the dentures click and everybody else can hear it, and the food gets stuck with those dentures, food can go underneath, and there are all kinds of problems involved with the dentures. But the worst of all is that the denture is either supported by natural teeth, it's anchored to the natural teeth, which in time, because dentures move around, make those natural teeth loose, and so you lose more teeth, or they're just sitting on the gum, and in that case, they have no support. They have to use those adhesives that they advertise for it. And what dentures do, they actually enhance bone loss in the patients. It's interesting to know that our facial structures, our lip and our cheek and all these things that we actually see are supported by the underlying structures, which are our teeth, and most importantly our bone, our jawbone. If we start losing some bone underneath these cheek and lip, we start having sinking in and collapsing of these structures, and that causes premature aging.
Your whole appearance changes. Then.
Absolutely.
Sure.
Absolutely. People who lose their teeth, they age much faster in their face because they have lost the underlying structures, which are teeth, and more importantly, bone. On bridges, if you want to go ahead with the bridges, to do a bridge, you have to, if there's a tooth missing, you have to cut the two adjacent teeth to almost half the size to be able to anchor a bridge in there. And you can imagine by cutting a healthy tooth to half the size, that's very traumatic to the tooth and it's damaging. By doing implants, we don't have to do any of these things. Implants is inserted into the jawbone and is not anchored to the other teeth. And by inserting that implant into the jawbone, we actually keep the integrity of the jawbone. In other words, implant prevents bone loss. This is not accomplished by dentures and is not accomplished by bridges. As a matter of fact, dentures enhance bone loss and cause premature aging. The most important advantage of implants is that it keeps the integrity of the bone and prevents bone loss, and it doesn't damage the other teeth.
Yeah, you were telling me that, we were chatting a moment ago before we started, that someone who has dentures, who has lost all of their teeth, that there really would be a way to use implants for them to give them a much more secure set of teeth in their head. How would that work?
Well, people who have lost all their teeth and would like to continue using their denture, but their denture is loose, we can place some implants that is used as an anchor to keep the denture in place. That way the dentures don't move around. Or if they want, they can get rid of the dentures and place more implants and actually replace all their teeth with implants so they don't have to use dentures anymore.
Are they becoming much more popular now, the use of implants?
It's becoming very, very popular. People are understanding the advantages of the implants. And as the people are becoming more familiar with the advantages of the implants, they're asking for it. Before, we had to talk to the patients and explain it to them. I have a lot of patients who come to my office and they know a lot about implants and they ask for implants. So it's becoming very, very popular.
You know, I can point out something here. I also am aware of the fact that, you know, just as short as several years ago, the insurance companies would not cover implants at all. But that's beginning to change now.
That is slowly changing also. Insurance companies are also part of the public probably. They're realizing the importance of implants, and they're starting to accept implants as a good treatment for the patients.
Because in the long run, in many respects, it's cheaper for them.
Absolutely. Not only it's cheaper, it helps the overall health of the patient,
sure,
and prevents bone loss and facial deformities, and that's important.
What's the process you go through when a patient comes in the first time to visit you?
The first thing we do is evaluation, identify the problem of the patient, of course taking the radiographs and see how much bone is available, and we set a treatment plan at that time. And when we want to place the implant, implant surgery is a very, very simple surgery that is done in the office, in a dental office, and in most cases, almost all the cases, under local anesthetic. If one implant is placed, it usually doesn't take more than half an hour, start to finish. It's a very, very comfortable procedure. We basically open the gum a little bit and place the implant in there and close the gum, and the patient can leave. Implants slips in the bone, and there's no function there for about 3 to 4 months. During that time, it integrates into the bone. Bone grows around it. It becomes firm. Patient comes back after 4 months, and we put a tooth on it. It's a very simple procedure. It's becoming easier and easier as the technology goes on.
Doctor, there have been so many advancements in the field of dentistry. I'm interested to know how a dentist like yourself keeps up to date on all of these changing technologies. You've been practicing how many years now?
12 years. 12 years.
And a lot has changed since you came out of school. How do you keep up to date?
Well, I should tell you that I have been practicing for 12 years, but I have been studying for 12 years also. I consider all these 12 years studying because the way dentistry is changing is amazing. Basically every week we have something new, some new technology. And it's really important to keep up with all this technology and stay on the cutting edge.
How do you do it?
By spending a lot of time going to the seminars, reading books, and getting together with the colleagues and learning from each other, teaching him and learning from him. And there are a lot of schools that are involved and teaching institutes, and this just goes on. I spend a lot of time, some of my weekends, some weekdays, going to seminars to learn more and keep updated. It's very time-consuming, I should say, but it's worth it. I can always provide the top technology, top treatment for my patients. It's rewarding for my patients. It's rewarding for me.
You know, I was just going to ask you, and it's a very difficult field, but is dentistry, especially even cosmetic dentistry, is it a rewarding experience to practice?
I think it's very rewarding. I think I feel the same way as a painter feels after he finishes a masterpiece. When I finish a cosmetic case and it's done and it's finished, I always take before and after pictures. That's a very good way of looking at it. And when I put the before and after look at it, I say, my God, I did that. It's great. It's amazing. It's very, very rewarding. And when I see a patient happy and satisfied and goes around and tell everybody, these are my teeth, that's very rewarding.
Doctor, interesting indeed. Thank you so much.
Thank you.
We appreciate it.
Thank you.
Well, that's it for this edition of Heartbeat of America.
We'll see you next time when we return with another story that is the heartbeat of America. Now for a final word from William Shatner.
Well, that's it for this edition of Heartbeat of America. I'm William Shatner. Thanks for watching.